Welcome to Family Forum, and thank you for joining us for tonight's program. I am the NAMI Finger Lakes Executive Director, Beth McGee. NAMI Finger Lakes is your local affiliate of the National Alliance on Mental Illness, the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. Locally, NAMI provides a helpline, support groups, and education and advocacy opportunities for families navigating mental illness. All of our services are free. This event is being recorded and it will be available on the NAMI Finger Lakes YouTube channel, where you can also find our previous family forums and other programming. After tonight's program or presentation, we'll have an opportunity for some questions that we've put together, and then we'll open it up to everybody. You can submit your questions in the chat. And wait until that time when we ask for the questions in the chat. That way they won't get lost in the chat. I want to make sure that we get to everybody's requests. So I would like to welcome Jessye Cohen-Filipic. Is that proper pronunciation? Great. And Samantha Stevenson. Jessye is a psychologist and Samantha is the director of operations, both working with REACH Medical to implement the LEAD program, or Law Enforcement Assisted Diversion. So welcome, Samantha and Jessye. I am going to go ahead and let you introduce yourselves so we get accurate information. And then if you can share your presentation, and we'll get to questions afterward.
Great. So I'm going to do the formal piece of the presentation, but it occurred to me, I'm not sure how familiar everyone in this group is with REACH. So Sam, if you want to introduce yourself and do the 60-second spiel about REACH generally, that will contextualize then what we're going to present. And then, yeah, I'm keeping my presentation relatively brief so we can take questions and really have a dialogue. So.
Sure. My name is Samantha Stevenson. I'm the Director of Operations at REACH Medical. We are located in Ithaca, New York. We opened in 2018. I have been with REACH since the beginning. We are a harm reduction-based, low-threshold healthcare provider. We provide primary care services. We have a very large panel of medication-assisted therapy services for people that are living with substance use disorder of any kind. We treat many patients that are living with opiate use disorder. We provide PEP and PrEP services, women's health, and we, of course, have an extensive integrated behavioral health system as well. So we don't deny care to anybody that is underinsured or uninsured. Really at the core of everything that we do is health equity. We're just trying to give everybody an opportunity to have easy access to wonderful healthcare. I think I could talk for a really long time about REACH, but I think I'm going to stop because I think we have a while for questions. So.
Great, thank you. So I am a psychologist who is transitioning from full-time to part-time work at REACH. And one of the things I have done besides overseeing the behavioral health clinicians is sort of put together the LEAD startup package for REACH and develop the training for the case manager and our screening and outreach coordinator. I tell Samantha every day that the saddest thing to me about going to part-time is that I have to let go of LEAD in some ways. So I'm really excited to talk to you about it. I think it's a program that has a lot of promise. It also is dear to my heart. I started my career as a baby mental health clinician in training in and around the criminal justice system. And the one other thing I'll add is NAMI has been an important organization in my life. And one of the coolest things I did in college was volunteer and go work as a reporter at the national convention. And I got to interview a bunch of people and write articles for the NAMI newsletter. So glad to be here for that reason as well. So I'm going to talk to you a little bit about LEAD and just to let you know that this is a program that is about to launch in Ithaca, but it's been in the works for really for about 5 years, seriously for about 3 years. And so there's a lot of ramp up to it. And I think the timing of it is pretty interesting. It's coincidental, but it coincides with a lot of other things going on in town. So let me share my screen so you can follow along. Like I said, it'll be fairly brief, and then I will, and just because I get paranoid about this, everybody can see my slides. Okay, thanks. And then we'll have plenty of time for questions. And it went away. All right. So this is not a LEAD specific quote, but this is by Brian Stevenson, and I hope his name is familiar to some of you, author of Just Mercy. But he says, how can mercy translate into practical changes in our criminal justice system? At every juncture, decision makers can be more compassionate. Police can presume innocence in interactions with individuals. Judges and prosecutors can recommend less punitive sentencing for defendants. Corrections officers can treat inmates with humility. One powerful way to exercise mercy: change how we treat the mentally ill and make how we treat the most vulnerable among us just. So we know that people with mental illness, psychiatric disabilities, are disproportionately adversely affected by the criminal justice system. We also know that by and large, people with mental health struggles are more likely to be the victims of crimes than the perpetrators. But there is this very nasty interplay between people living with active symptoms and the police or the justice system in a lot of different places in this country. And, you know, I could go on a different day about all the different programs that have been implemented to try to shift that. But LEAD is at its core a harm reduction approach to crime. So in 2011, in an attempt to move away from the war on drugs paradigm, and specifically to reduce the very striking racial disparities in police enforcement, LEAD was founded, developed and launched in Seattle, Washington. And its goal was to respond to low-level offenses such as, drug possession, sales, prostitution. We'll get into a bit more of that. And it's a pre-arrest diversion program, which essentially means people are referred to the program, brought into the program before they actually are arrested, charged, tried. There's essentially no legal charge hanging over one's head when they are referred to this program. And what LEAD at its fundamental core does is acknowledge that many offenses, criminal behaviors, whatever you want to call them, are rooted in poverty, substance use disorders, and mental illness. And essentially, that many crimes come out of unmet behavioral health needs. And so that the answer is to try to meet some of those needs rather than criminalize. So police officers have the discretion at point of contact. So when a police officer encounters an individual, they have the discretion to choose to divert to this community-based harm reduction intervention. Instead of the normal cycle, which would be booking, detention, prosecution, conviction, and incarceration, individuals are instead referred to this trauma-informed intensive case management program, where people will receive a wide range of support services. This will often include transitional and permanent housing. It may include substance use disorder treatment of a variety of forms. So we're talking medication-assisted treatment or perhaps traditional outpatient counseling for some people. Detox or rehab might be the appropriate next step. And then the sort of prosecutorial and enforcement side work closely with case managers to make sure that all contacts with people who are enrolled in LEAD, including new possible arrests, new criminal prosecutions, are coordinated with that person's plan in order to maximize the opportunity to achieve behavioral change. So it was really beautifully explained to me by the people who are kind of helping us get launched in Ithaca, who are from the National Support Bureau for LEAD, which is basically you can't get kicked out of LEAD. It's not like a two strikes approach. when you're enrolled, everything is done to, I mean, of course, there's going to be extreme circumstances, but committing another like offense simply reinforces your need to be in LEAD. It does not kick you out of LEAD. It does not make people think you shouldn't be there. In fact, it says, okay, how are we serving this person? And in what ways are we not serving this person? And what do we need to work on? So a bit more about the pre-arrest diversion versus other diversion. So in Ithaca, we have other alternatives to incarceration. So we have other diversion programs. Family Treatment Court would be one of those. The Ithaca Wellness and Recovery Court, which I'm very involved in, which is the mental health court, is another version of diversion. But a pre-arrest diversion program means we move away from the justice system entirely without having entered it. And we provide behavioral health services guided with these partnerships with the criminal justice system, but not driven by or within the context of the criminal justice system. So it's a public health solution that actually leads to better public safety and lower crime. In contrast, these other approaches to diversion, which are useful and important, but we're moving out of the justice system after having entered it already. And it's criminal justice that's guided with outside behavioral health partnerships. All right, so LEAD launched in 2011, still relatively new. At this point, I think they said they currently have almost 50 sites across the country, and they're launching another 35 this year, so it's expanding pretty rapidly. But they did some research after 3 years in Seattle, and in 2015, they hired an independent evaluator to do a non-randomized controlled study, and they found that nearly 60% of LEAD participants were nearly 60% less likely to be arrested after enrollment in the program compared to the control group that went through the regular kind of treatment as usual in the criminal justice system. So this reinforces that notion of it as a public safety program. So it decreases the number of people arrested and incarcerated, and also serves to decrease the actual criminal offenses that are being committed. And there were also preliminary program data that I hope we'll get to learn much more about, that it improved the health and well-being of people who were participating in the program. So it wasn't just keeping them out of jail. That's no easy feat, but it requires a whole lot more going on in someone's life. It's one thing to say, okay, we're just going to watch you and make sure that you don't commit another crime. It's another thing to thoroughly address their needs in multiple areas. So LEAD is completely voluntary and happens at the pace of the individual participating. So at any one time, one participant might be meeting with the case manager twice a week, where someone else might be meeting with the case manager every 6 weeks, where someone else may not have actually found the resolve to meet with the case manager. And so it might be that the screening and outreach coordinator, who's the kind of the first line person, is trying to track that person down and is reaching out to members in the community and reaching out to police, to the law enforcement to say, hey, can you help me track this person down? I haven't been able to connect. It is very much person-centered in that individuals participate and drive their service plans, their individual service plans, and they identify their goals and objectives. People, I don't think this is the number one priority probably of the group I'm speaking to right now, but people are always interested in the bottom line, and it is a program that requires resources. In other cities, it has been shown to pay for itself in the long run by decreasing the cost of court and prosecution and of the criminal offenses. So in Ithaca, like I said, they first started talking about LEAD with the development of the Ithaca Plan in 2016. There was an attempt to secure funding in 2018, and then we were finally awarded it in 2020, or we weren't, but the city was, to cover basically all startup costs and programmatic expenses for the first 3 years. The goal is to make it self-sustaining or self-sufficient. So nobody wants this to be a project that would end after 3 years, but that's sort of the initial investment. So this next slide represents the LEAD Seattle and the LEAD National kind of core values. So we're reorienting the government, specifically the police response to safety, disorder, or I like to think of it as sort of disruption or chaos, and health-related problems. So instead of immediately thinking, how can we incarcerate this person? How can we get this person off the street and into a cell? We're thinking about it differently. What can we offer this person to help them continue to remain safe and well, or to become safe and well so that they don't find themselves in this situation? Looking to improve public safety and public health through a research-based set of interventions. So again, harm reduction. In a harm reduction approach, we're looking to minimize harm to the individual, the community, to the entire system. And so we're not asking for specific outcomes. Often we talk about this in the context of substance use disorder and talking about abstinence versus not having an expectation of abstinence, but this is also related certainly to mental health. Someone doesn't want to take their medications. We talk with them about other ways, what's going on, why don't they want to take medications, what is that, what's their experience of taking medications, and then, what alternatives are there? What other ways can they manage to keep themselves safe and functioning? So to reduce the number of people entering the criminal justice system for these low-level offenses, again, which we are seeing as rooted in these other identities or these other issues that aren't actually about committing criminal acts for the sake of committing criminal acts. Undoing the racial disparities at the front end of the criminal justice system, meaning at the point of arrest. Trying to create a sustainable model for funding for alternative interventions by capturing some of the savings. So reinvesting savings from the justice system to create and sustain these new programs. And really, and this is what is, I think, interesting in our current context in Ithaca, the goal is to strengthen the relationship between law enforcement and the community. You can imagine in any community where LEAD starts, there needs to be buy-in from law enforcement. This is up to them. It's their job to decide to divert people. And I will say in the, 7 or 8 months that I've been involved, I can see that wasn't necessarily an easy sell locally. And part of that is LEAD funding was secured and advertised just around the same time or just before the mayor announced his plan for reimagining. And so people have assumed that this is part of reimagining. Certainly, I think some of the values are consistent, but I would like to extricate it from that controversy and say, no, this was an idea that lots of people had before that was put into place. And it's not in order for LEAD to work, it needs to work with law enforcement as a partner, not as an enemy. And I think that's a difference in the LEAD framework. All right, so specifically in Ithaca, these were the goals that were articulated in the initial proposal. So again, to reduce the racial disparities in the criminal justice involvement, specifically for the Black African-American population in Ithaca. To reduce unnecessary arrests and prosecutions, improve officer efficiency, maximize the value of our community-based service array. As all of you know, I think in many, many ways, Ithaca is resource rich. We just sometimes need to coordinate and collaborate a bit better. And then to improve the outcomes for people whose repeated arrests stem from those unmet behavioral health needs. All right, so in the city of Ithaca, our LEAD project involves a partnership between the city and Reach Medical. The city, I've separated out IPD because I think of those as the sort of three primary partners. So the city, the police department, and Reach. The person who is heading LEAD for the city of Ithaca is Travis Brooks at GIAC, and his community engagement coordinator is Gloria Kweku. And we are partnering with them. We are the boots on the ground in many ways at Reach. So we're running the case management program. And so I think in many ways our staff will be more visible. But Travis is responsible for doing all of the negotiating with the police department and with the city and with the mayor. He's also organized a community leadership team, which is a part of every LEAD site, which is essentially community leaders who come together and talk about LEAD and sort of make decisions, and also are expected to promote LEAD once they're fully informed and sort of educated that that's part of their job. And then there's what's called the OWG, or the Operational Working Group. And this will become more important in a minute, but this is the group of kind of LEAD partners. So this is where right now in these meetings, it's the district attorney's office, the police department, Travis and Gloria, REACH, and a couple of other community outreach workers. And they're sort of the operational team, the working group for the day-to-day operations for LEAD. So this is something I expect we'll talk a bit more about in questions, but how do people get into LEAD? Well, the primary referral source is law enforcement, is the initiation at the time of potential arrest. I'll spare you the sort of nitty-gritty. There are kind of different technical ways. So if for whatever reason, let's say someone is highly intoxicated at the point of contact, they can't consent to LEAD. And so law enforcement can't do the referral when someone is unable to consent, but they might follow through with it the next day and it gets a slightly different name, but it's still law enforcement initiated. And then there will be some referrals from community members and agencies, but they'll come from that OWG, from that operations working group. I expect that there will be overlap in the lists of individuals that are identified by all sorts of different stakeholders. So one of the things I've been sort of thinking about ahead of time is, community members who aren't in the OWG or agencies who aren't necessarily represented at that table will surely have people in mind. It's not that they can't give us that information or have conversations with us. It's just the way they sort of try to manage the flow of people. Right now, we're just in that stage of trying to let people know what LEAD is and think about it and start to talk about what that looks like. But I don't think it'll ever be that someone will have a really strong desire for somebody to be considered for LEAD and they just won't be considered because they don't come from one of these groups. We just don't know. We could be flooded in the first week, right? This is an opportunity to get some much needed services to people who don't have them. And so we kind of need to see what happens with that. All right, so this was when I realized I'm saying why REACH, but some of you may not know REACH. So this is, again, a brief version, but we can give you more information after. So REACH is known, as Samantha said, for our harm reduction approach and a focus on health equity. We're known for engaging with people who are marginalized and on the outskirts. We have a pretty successful outreach program specifically with people who are homeless or unstably housed. A lot of this has exploded in the last 13 months, including people who are in homeless encampments, connecting with telemedicine via outreach workers having a tablet with them. We've also been doing COVID testing and COVID vaccination in these different settings. Our general medical practice, our philosophy is very consistent with the philosophy and the principles of LEAD. And we're very well connected with other community organizations. So REACH doesn't have a case management department or a case manager program, but in many ways, everybody at REACH does some case management. It's just sort of the nature of the beast. So I think that the city and Travis specifically thought we were pretty well suited for that. All right, so the REACH LEAD team, Samantha oversees the LEAD case management team. Like I said, I helped with some of the training and the onboarding, but she'll be the oversight. Anna Vergari, who is listening in, she's very new to the position as our new case manager. We're really excited to have her. And then Ricky Stewart is our screening and outreach coordinator. And I just realized that Samantha gave me the email address and I didn't add it to the slide. So we'll make sure that people have that, the LEAD contact information. And then our team will grow as participants enroll. So it's sort of a phased growth. So once Anna starts taking on participants, which we expect to happen in July, once she gets up to a certain number, then we'll hire another case manager. It's a very low number of people because of the intensive case management, which I'll talk about on the next slide. But it's not a factory approach to case management. She's not going to be carrying an overwhelming number of cases because we want her to be available to do whatever her participants need, and we expect that these will be very high need individuals. All right, so what does intensive case management entail, at least in the LEAD model? So it's going to be helping people find temporary and permanent housing, connecting people with whatever mental health, primary care, and other medical services they desire or perhaps have been lacking. Helping people to identify and define goals. Now that is a specific piece of LEAD, but it's also just a really important kind of self-empowerment strategy, right? For people to be able to step back and think for a minute, what is it that I want to do with my life? How do I want to be? How do I want to determine what wellness or health means to me? Case manager will serve as a liaison to other professionals, will accompany participant to appointments and court dates and things like that. Vocational employment assistance is a big part of the program, including some specific ideas about vocational training programs and support for people who might be participating in those. Help meeting other basic needs, so making sure people have food, making sure if once they have housing, they have utilities. And then peer support is built into the model. So our screening and outreach coordinator is a peer and is going to work hand in hand. The case manager and the screening and outreach coordinator will work closely together. But part of the goal and something we've been working on at REACH generally is with our community health worker positions is making sure that we're putting people with lived experience into these roles, because people who come to our programs and come to our clinic and enroll in LEAD want to talk to other people who have been there in some way and want to be able to connect on that level. And so luckily that's built into the national model for LEAD and really important to us at REACH. All right, so I talked a lot and fast, but luckily that leaves us lots of time for questions. So Beth, I don't know if you want to start with some that you had already.
Yes, I do. Thank you very much for that presentation. It answered a lot of the questions that I had, and I'm sure questions that other people had. So if people do have questions and you want to put them in the chat, that would be helpful. And then we can try to get to as many as possible. I wanted to go back to, you did speak about the LEAD model and that being with law enforcement being the determiner of, whether or not a person is going to be engaging with LEAD. And so from the LEAD Bureau website, they have an announcement where they're stating that the Movement for Black Lives has created an opening to radically rethink how American communities pursue public health, order, safety, and equity, and that the Seattle program is now known as Let Everyone Advance with Dignity, and that they're developing a new option for LEAD operations that decenters law enforcement as the gatekeepers. So I don't know how well they're communicating that to potential LEAD programs, but our Reimagining Public Safety recommendations, they do seek to decenter law enforcement from our crisis response and substance use crisis. I'm wondering if you're open to that approach, because that is, you're committed at this point in the way that you're working, and you've gotten buy-in from law enforcement. And of course, we still need law enforcement in some situations. We recognize that, but yeah, I'd be interested in that, because I was actually very excited to see that development. But I would hope they would also support you in that.
Yeah, so I have a couple things, and I'm sure Sam also has something to say. So yeah, it's funny. I keep clicking through that, it pops up, and then I keep clicking through it to get to the resources. They haven't talked with us specifically about that. I was also very excited to see it, and believe me, I am desperately ready to see that. So I lived in Portland, Oregon for a while, where they have a really nice model of at least having specialized police training to do crisis intervention, and a really well-trained officers. I don't think that's the perfect version, but yes, I wish I had options other than, to either call the police directly or call mobile crisis when they will then bring the police, because in so many circumstances, it just escalates the situation. So what I like about the existing, and so I think I will speak for not me, but certainly REACH is open to anything that decentralizes and de-emphasizes law enforcement and puts other people in that space. I have always appreciated that there is this social contact referral process, so it doesn't have to all come from law enforcement. The other thing I should say is that the people who will be serving as lead officers are people who have volunteered for it and will be trained very intensively. So I don't, as much as it is law enforcement driven and that it's at their discretion, I actually just see them as another high contact stakeholder, right? So they just see these people all the time. And so, I don't know, I've been just thinking of them as sort of just another referral source, even though, of course, the name does not imply that. But yes, I think locally people would be very open to whatever kind of reimagining of LEAD is coming up. But Sam?
I think I totally agree with everything that you said, Jessye. And for me, it's always hearing personal experiences that kind of like humanize these initiatives. And through the LEAD national meetings and Zoom conferences that we've had the opportunity to meet and speak to many of the pioneering LEAD officers who were self-identified as cops. They were kicking doors in. They were, kind of like at the top of the ranking of the police station that they were working in. And all of a sudden they had, a life-changing experience in that came from all different ways, and they had seen the same participants coming to them over and over and over again. And they had seen the negative outcomes of the options that they had. And one of the things that really brought it home for me was hearing one of the officers say, I only ever had two tools. I could arrest someone or I couldn't arrest them. And I would have to run the risk of maybe them doing something bad to someone publicly or whatever bad outcome. And I didn't want that on me. I didn't want that to be my responsibility. So I knew that the system that I was putting them in to by arresting them was going to do no good, but I did it every single time because I only had two tools. And now with LEAD, this is an option for a holy partnership to say, this person has unmanaged or undiagnosed mental health problems. This person doesn't have their basic needs met. This person needs stable housing and food and access to healthcare. And that's where LEAD kind of comes in. And that's where this extensive case management comes in. So we're not bringing one tool, we're bringing a whole entire, spread of options with this extensive case management. So I do think decentralizing police is something that the community in large would be in favor of.
Thank you. You also mentioned this, let me backtrack a little bit. When exactly is the program going to start? When is it officially starting? So
I think it'll be launching. I think we'll be enrolling our first participants in July. Okay. So one of the things that happened was IPD was on board. There were officers on board. Reimagining was announced, and there was a significant exodus. from IPD. So the officers who are, it doesn't mean that that's what's kind of holding us up, but the officers who are most invested can't control their schedule. And so, but yeah, we have, I think it's really Sam's call, basically, that we've got our people on board and trained up, and I expect in the next month it will go live, as they say.
Okay. And when an officer encounters someone and they're engaging with them, can you describe the scenario for me? What are the steps for us to better understand? And what is the assessment tool that they're going to use? Do they have a checklist? Is it, the way they're presenting? What are the things that help them make that determination?
Sure. So at contact, they, one of the things we're expecting is that this is not going to be the first time that they have encountered any of these people. So we suspect it's going to be a repeated contact. But at contact, it really is kind of, do I think this person would benefit, and do they seem like a good fit? And then there are very few inclusion criteria. That's very broad, but the exclusion criteria are pretty specific, and that's really mostly violent crimes or kind of things that go beyond the scope of those lower level offenses. So there's like, the questions at the moment are, do they have outstanding charges? Do they have they committed crimes that will exclude them? Are they violent? And then it's the officer's decision whether they, or the referring person's decision, but in this case, the officer's decision about whether they want to offer lead. Then they ask if the person is interested in lead. And at that point, the screening and outreach coordinator, if they offer it and they say, would you like to hear more about this program? And the person says yes, and they seem of sound mind, then the screening and outreach coordinator comes to give them the rest of the information. So the role of the officer is critical in that case, but very brief. And essentially they're done. They're not waiting around to see what happens. They're not threatening the person. They're not telling them, if you don't do this, this is going to happen. They decide. And so, people have said, well, who are cynical about law enforcement, not just in Ithaca, well, what would ever make them refer? What if they decide that nobody's appropriate? And I just have to think again that there is some benefit to not have to encounter the same person over and over again, and the same people over and over again. So, but it's a very brief contact with the police. And then, so they don't really have an assessment tool that they'll be using other than looking at those exclusion criteria. And then all of the sort of further assessment comes from the case management team, but then that is really just getting to know the person. It's not assessing their eligibility. Does that answer your question?
Yes. And how will you be communicating with the officers who are referring so they understand what point that person is at, if they've actually participated, if they're getting services? Because if they see them again, somewhere, have more engagement with them, then they need to better understand what the status is.
Right. So those biweekly OWG meetings are where everyone sits down, and I expect it's going to run like a case conference, that we're going to run the list of people. So-and-so was offered lead and said, yes, they're at this stage. So-and-so was offered lead and said, no, but I just picked them up again. And so-and-so picked them up again. Should we offer it again? That's my hope. That's certainly the way I think those meetings are intended to run.
I also think we strayed a little bit from the boxed model, in the sense of we hired Ricky Stewart, who is an outreach worker, versus 2 case managers right out of the gate. And so I envision Ricky to be on foot in the community, seeing the police officers that are regularly patrolling the busy areas, like Ithaca Commons and the encampments and around that area. And Ricky will know where the participants kind of are in their journey with LEAD as well. So I see him being a community liaison in that way also.
Thank you. And you mentioned having the meetings, and we're wondering if you would be part of SPOA meetings to hear about possible referrals. You may likely be part of those meetings already in some respects, and or reentry meetings as they happen in the county. And also one other question that goes along with that is, can a person who's already working with a program like ACT be referred to by the police to reach?
You want to take that, Sam, or you want me to?
You can, go ahead.
Okay. So I'll start with your last question. Absolutely. I mean, I think there'd probably be some concerns with people who are engaged with ACT successfully. Well, yeah, I mean, we don't want to duplicate services, so we certainly want to look at who has services and who doesn't, but it does not exclude them by any way. And if it would be, a better fit or a nice addition, then I think that makes a lot of sense. I have been trying to get to the SPOA meetings for quite a while for lots of reasons. We have lots and lots of people at Reach who have desperate housing needs. We're making some headway. I think, Anna and Ricky we're very connected with reentry orgs and housing orgs, and they're starting to get more familiar and kind of involved as they come on board. And so they're definitely attending meetings and sort of task force meetings with URO and the homelessness task force. And there's a street outreach coalition, expanded street outreach coalition. And I think that SPOA piece is a missing link that we need to keep working on. I mean, we certainly we take a lot of referrals and complete a lot of paperwork for people. And I really would like, for lots of reasons, for someone to be sitting at that table.
Okay. There are some circumstances that preclude someone from participating in a program like the Wellness Court due to being too symptomatic or having repeat issues because of that. And if somebody receive some services, but they aren't getting case management and they end up homeless, what does that look like? Is that something that Reach can help them with, or is that just another service they're not going to be able to access?
So somebody who's enrolled in LEAD?
No, not yet. I mean, I'm just, this person is asking if their loved one is not able to participate in other programs due to being too symptomatic or, having repeat issues because of presenting symptoms.
Oh yeah. I mean, I think LEAD's a big tent, bigger than any others. And it is a housing first program. So, not that that's the only thing you're talking about, but I would say, there's a deep recognition that of the hierarchy or the pyramid of needs, however you want to think about it, and that you can't focus on these higher level needs until you can feel like you have your basic safety needs met, and then you see. But there's nothing that precludes someone who is actively symptomatic or too symptomatic from participating in the program, in part because participation is voluntary and defined as the participant wishes. So, that person's initial service plan, their goals might look very different than they do, a year down the road. But it's very much about meeting people where they are. And I would hope that at all levels for LEAD, that people would recognize that, including at the IPD.
Okay. And the Tammy Baker and Natalia Kolrich, they're really wonderful in the community. We're wondering if you are going to be working with them as far as getting referrals from them, because they're really on the ground and meeting that need.
Yeah, so they are on the operations working group. I mean, I think when LEAD was, when the funding, when LEAD was first conceptualized in Ithaca, there weren't a lot of other outreach workers, but now, we have, so we are working with them, but Reach also does now have a robust team of their own that go out sort of more broadly than Tammy and Natalia. But in fact, a lot of our outreach happens in conjunction with at least one of them. So yeah, they have a literal seat at the table.
Great. That's great to hear. And the case manager, we have several questions about the case management. One is, we know locally case management can be up to 100 experiences that someone is managing, and we'd like to know what that number looks like to you. You did mention it kind of a little vaguely, but also that there are limitations and you want to make sure everybody is getting care. So what does that mean?
It's capped at 25 per case manager.
And you did say that when a caseload is full, that you would work on hiring another case manager? Before
it was full. So our expectation is, when they get to 10 to 15, we would start looking for another person. No, I mean, I don't know that this is, so LEAD is operated in cities of many different sizes, but at least locally, it's been very clear that this is, and of those 25, we've talked with the national folks about this. They expect that 5 of those will be in the kind of outreach stage where you haven't even engaged them. You might have 5 who are in the alumni or sort of well-progressed, not in the beginning, obviously. And so you're really looking at 10 to 15 active, ongoing cases, and certainly engagement with those people could vary significantly. You may have someone who takes 1 to 2 hours of your day every day. But no, they are not interested in creating this sort of dumping ground of case management, because it really truly is an intensive case management program.
And we've been recognizing for many months that we have intensive need here. So while you can cap caseload at 25, what are you capping your number of case managers at as far as hiring them for the program?
Yeah, so in many ways, I would say to be determined, but the initial grant is up to 3 case managers and 75 participants, which the assumption, so nobody ever has to leave LEAD. Nobody ever is discharged from LEAD, actually. They can certainly choose to disengage or to be done, but people are invited to continue to seek whatever level of services they want. But I think the idea is that there will be some, attrition is not the right word, but there'll be some ebb and flow, and that there'll be people who kind of move off of your caseload. But I think, and I did see a comment in the chat about this. I think this goes back to that sustainable model, right? So I don't remember what they told me, but a number of these cities and sites now have 24-hour coverage for their case management team. I don't think it's ever going to get there. We don't have 24-hour coverage for anything. But I suspect that if the numbers are working and the city is seeing real outcomes, then they will hopefully continue to invest in the program.
Okay, and so that we do not have, or the case managers will not be 24/7 availability. Is that what you're right? Okay.
Right.
Okay.
So right now we are, and certainly won't be when there are 2. We'll see when there are 3 plus an outreach person. We're trying to, so this is a challenge with the referrals, right? Now remember, even if the officer can't refer the person at 2 a.m. because there's not someone there, at 9 a.m, that person can walk in. The officer can call REACH and say, I want to refer this person at 9. That person can come in and still join. It's not the same as doing it in the moment. And they obviously have to decide they're going to let that person go for the night, but it's not like it's a totally lost opportunity.
Right. Okay. And so so there isn't going to, so we're still going to operate with the mobile crisis model as well. So if someone is in crisis, mental health crisis, in the middle of the night, and then that's the avenue that they're going to take with that response if there's not a case manager available.
Right. I think there'll be some question about, if someone is already enrolled in LEAD, there might be some question about coverage once there are multiple people. And we have 24-hour on-call coverage for REACH, not behavioral health necessarily, but we will be directing off hours and our case management team is going to work some evenings. They're just not going to be working at 4 a.m. We do have a mechanism for people to reach the on-call provider at Reach. And then I think we'll have to see. Yeah, I think probably, certainly for people who are not yet enrolled in LEAD, if someone's in crisis, that's probably going to be the approach for now.
Okay. And so let's shift a little bit to sustainability for the program. So you did mention it, and that was actually one of my first questions I had taken down is, so how will we keep supporting this program if it's successful here? And you did say diverting funding in the, looking at it as an umbrella of public safety funding rather than a police budget and this budget and that budget. If we're kind of shifting funds around, the goal would be to have savings with law enforcement engagement. And what other is the city, and will it expand to the county? How, because the city is within the county. How will that look? And are you hoping to get stable funding from the municipalities as well?
Sam, I'll let you take this one, especially since you've already started working on more financial sustainability.
I think it's early on to know a clear path to sustainability for this, especially without reportable data outcomes. What I can speak to is that we are mindfully putting in place our desired metrics that we'd like to meet within the community for each participant. And by meeting these goals for each patient, we will decrease the needed police force. We will decrease the amount of court costs and criminal justice costs and all of the collateral costs that come with that. And like Jessye said, Ithaca is so resource heavy that we have a unique opportunity, and we are taking advantage of the opportunity of working closely with a lot of other organizations within the community and talking about these desired outcomes, so that essentially we'll have solid ground to stand on for the savings amount that this program will induce if it's successful. I don't know if that makes total sense right now, and I can go into more detail if you have questions, but it's so early on that I think right now we're just kind of like mindfully laying the bricks down for the foundation of it.
Of course.
One other thing I will add, so Reach is always looking at sustainability, right? We're a new organization and we're recently OASIS licensed, and nobody has caught their breath in 3 years. So we're also looking at ways in which, case management funding is difficult. I've talked with Harmony about this, but we are looking for ways in which we can offset any soft money with billing. And so there are pieces of this case management puzzle and peer support services that are billable or can be billable, particularly if we get, for example, the peers that work with us would get trained as peer advocates through the OASIS substance use disorder path. But if we can get people who are already interested, invested, bringing the lived experience, trained as certified peer advocates, then we can bill at least something for those services. And we are looking at other sort of funding models for case management. Unfortunately, a lot of that funding is disappearing or is earmarked for kids and families. But we're having those ongoing conversations because multiple agencies and organizations and groups have come to Reach saying, can you please give us a case manager? And we say, can you please give us the money for a case manager? And then we'd be happy to do that.
Mm-hmm. Mm-hmm. Yes, I feel that pain for sure. A lot of your support and success is going to rely upon the services that are in the community that can help you meet the goals of the people you're serving. And much of the housing that's being built, we just heard a report at a meeting a couple of weeks ago about all of the housing that's in the works for different needs. And but some of the new housing that's being built for these needs are replacement housing for older, not useful properties anymore. So do you feel that you have the housing support locally that you need? Do you have thoughts about how we can meet that need more effectively here? I mean, we all sit around and brainstorm about, our dream and wish list here, so, and how we'd like to see things go. So I'm sure that happens in other places.
I don't know. I would expect that Sam feels the same way. No, I don't think we have the housing support we need. I don't really know how Ithaca ever will, except that I also have fantasies. I think there's a 2-stage model, and I think we'll be much more successful with the temporary housing, but that's not sustainable. That's not stable. That's not really life affirming, right? It gives people a bed. But at least I feel glad that we can do that without jumping through the many hoops that it even takes to get there. And then we're going to keep hounding the housing folks and listening to what they have to say. And I think, some people also heard that same overview of what's coming. And I wish, and it is one of the things I've wondered that I'll wonder out loud is what restrictions are there on finding housing, right? They're not on probation or parole. They're enrolled in our program, but if they go live, if Groton is where they can find housing, what does that mean for their involvement in the intensive case management lead? And I think that's unfortunately a problem for many people. Their services are in Ithaca, but there's no housing that they can possibly afford. So
that's a big problem that you're bringing up, because if someone is engaging in the city with this program, and rural housing is, it's often substandard, but it's affordable. So that tends to be how people are pushed, unless they're in a shelter or a hotel or in an encampment.
Right. And so, I don't think there's anyone saying they couldn't participate. Then we have a transportation issue, or a telecommunications issue, right? One of the beautiful things I do think that's opened up is we are very creative about getting to people or getting people connected to us. But yeah, I don't think anyone would say that they couldn't engage. It does put another barrier in place. But I would hope that we could. One thing we haven't figured out the transportation piece entirely, because right now REACH is not in the business of having employees transport people. That's certainly what lots of case managers do in agencies that have more case managers and have different liability coverage. So it's something that we're going to have to have a larger discussion about.
But you're not saying, though, that because this program is being started in the city with the being instigated by the city, that it's people are not going to be precluded from participating because they're moving out of the city or not living in the city.
Correct. The only thing I wonder about that is, do they have any other, right? Are there any other legal hanging on things separate from LEAD that would prevent anyone? But no, absolutely. I think it's the city is where the criminal act occurred, but other than that, there's no requirement that people be in the city.
Okay. All right. Thank you for clarifying that.
Yeah.
Let's see. Just a few more questions myself, and I think I've covered pretty much everything in the chat. If anybody had a question that I did not cover, please resend it in the chat. So I wanted to talk a little bit about how NAMI can support this initiative, because, and I'm glad that you mentioned that you're familiar with NAMI's work and that you have worked on projects in that regard before. So we have a really strong history of advocacy, and we actually met with NAMI affiliates across New York State, met with all of the state legislators this year in Zoom meetings, and we advocated for more funding. We advocated for legislation, and we were pretty successful in that. But NAMI as an organization, even federally, has 40 years worth of experience in advocating. So we were also instrumental in the implementation of the wellness court that you mentioned. So what can NAMI do to advocate for this? How can you see us being most helpful in that regard? Where do you think our efforts would be most helpful?
I think that there's a current environment that exists within the Ithaca Police Department right now that was induced by our mayor's reimagining policing that came out. And I think that it's been an all too easy thing for the police force itself and the general public to kind of lump LEAD in with reimagining police. And Jessye touched on this earlier. But I think that the educational piece in the community is going to be hugely helpful for community buy-in, because like you said, this takes a full community to make it be successful. So Anna Vergari, who is listening in right now and is the lead case manager, and Ricky Stewart, who wasn't able to make it tonight, they have been reaching out locally to organizations and kind of key players in the community and meeting with them and providing education around LEAD. But I think advocacy specifically could be really helpful. I think just in that regard of what is LEAD, this is what they're doing, here is kind of the ground that we're standing on and where we're working from, and this is what this means. So I think that type of advocacy can be largely helpful in the community right now, specifically in the Ithaca Police Department. I met an officer 2 weeks ago that had in Ithaca that had never even heard of LEAD. They'd never even heard of it, and we're about to kick it off in a couple weeks here. So if you have officers that are patrolling in the city and they have no idea what the program even is, then it's hard to imagine it being successful.
Yes, I agree. Sometimes we run into that when we're speaking at events to educate about the family experience. Officers will often say, "We never knew you existed. We didn't know what NAMI was," that there was that kind of support here. So, I've also heard you're the best kept secret in the community. It's like we don't want to be a secret around here, so we really want to spread the word.
We've heard that about Reach also, and there's keeping up with the work that comes in the door. Sometimes it's really hard to self-advocate for the organization that you're working in, So yeah. I think advocacy in that way would be really helpful.
I don't feel completely articulate about this. So for my first 7 years in Ithaca, I was at Ithaca College as faculty and only doing very small clinical practice. And I'm a foster parent. And so I encountered the mental health and social services and human services world in lots of different ways, but I've never fully gotten a grasp on mental health services. Well, there's a shortage, there's an abundance, there's all of those things at once. We get a lot of people at Reach who feel like they haven't had good experiences with mental health services. And I have great respect for people at Tompkins County Mental Health, and I'm developing relationships and working with them on different projects. But I also heard the other day, someone told me about someone being kicked off the ACT team. And I have to tell you, I've lived in 4 cities with robust ACT team programs, that I've never, ever heard of someone being kicked off that's antithetical to the ACT team, to the model. And I feel like I've heard, whether people have explicitly been dismissed or they feel they've been dismissed from the available public mental health system, that breaks my heart. And REACH has behavioral health, and we started this great program, but the needs are deep. And so, this is your bread and butter. This is stuff you're already doing, but I would say, help us continue to navigate for trauma-informed, inclusive, welcoming mental health services for all.
Yes, thank you. It is not a surprise to me to hear what you just said. We have had, the family members have reported concerns about that, and we certainly understand that services are really stretched, and that there is a huge need here. We got here somehow. And we're a pretty enlightened community, but we still ended up here somehow. So hopefully maybe someday we'll be enlightened enough where we don't need LEAD, or any of the other diversion programs, and that we decriminalize mental illness and substance use to the extent that people get what they really need.
Absolutely.
So I guess, I think, so yeah, I got another question in here. Yes, the question is, does REACH have a list of the cities and states where LEAD program is? That is available on the LEAD Bureau website. They do have a list of already active, and then in the works, and working on
and in fact, I'll drop the link to that map in the chat just so people can see that.
Okay. Yeah, they asked the question in case any of their loved ones are actually living in a city where that exists. So, and someone else is asking if, and you may not be able to do this, but are you able to generally expand on the idea of what situation may have gotten someone removed from the LEAD program? Or no, not LEAD.
ACT program?
Yes.
No, it came up. It was in a wellness court context, and it came up, and I stopped the meeting and said, "Are you kidding me?" So I assume, or I presume, it was a perception of safety. I don't know that I would. Yeah, I don't know if how realistic that was, but yeah, in my previous experiences, and again, they've been larger cities with much bigger programs that have been around longer. That just wouldn't have happened.
Okay. And there is thank you. I understand that could be delicate. And there is another question. The difference for people eligible for LEAD in contrast to wellness court, and I assume wellness court means they've already had some charges, a scenario where charges exist that they have to reach some goals with.
Right. So that's that pre-arrest versus post-arrest diversion. I'm really curious to see what happens, especially being someone who is so involved in wellness court. I think people who are already in wellness court actively probably end up not being eligible for LEAD right now. I'm not sure of that, but because they would have ongoing charges that are still tied up in whatever's happening with wellness court. But I think it'll be a really interesting interplay between those.
Yeah, I'll be curious to see if the caseload in the wellness court decreases.
Well, so they are, I would expect not, because they've expanded to felonies, and they're now expanding to a much wider catchment area.
In the county.
Yeah, so they're expecting explosion.
Oof, okay, well, I'm glad they exist then. For sure. Okay, so Jessye has put that link in the chat, and if you want to stay in this window, or I guess you'll go out of this window, but you can come back to this if you click on it. I'm not sure if people can copy and paste that, but I don't have any more questions. So I'm just going to give you a few moments if you have any final thoughts that you want to share. And you and Samantha or Anna.
All right, you're welcome to talk if you want to, Anna, but no pressure. I'm going to put the lead email address. Right, Sam?
Yeah, and I think also I can put my email address in the interim. That lead email address is active, but until the initiative kind of really kicks off, you're likely to get a quicker response from emailing me.
And can families refer?
Not yet. So families can talk to any of those people on the OWG, and those people can bring it. There is something in many LEAD programs, a third referral source, which is community referrals. I think, again, as a way to control flow, we're doing the law enforcement and the social contact referrals, which are that sort of smaller group. So for now, I would say that family members should talk to one of us or someone who's on that. So either Tammy or Natalia or someone at Reach or someone at IPD. I expect there will be an opportunity down the road for families or for community members to directly.
Yeah, I think also expansion on, the ongoing, the work group meetings. As the program expands, I expect that we'll tap into more and or different members of the community, therefore expanding our referral process.
Okay.
Oh, sorry, I didn't. Oh, yeah. Okay.
And there were just a couple of other last quick questions. Someone asked about the OWG, and that is your committee that meets. Is that, or your team?
Right.
That, yeah.
That's the yes, and that's where Natalia and Tammy and other various members from the community sit.
Okay. And can you touch a little bit more on how you're educating the public about LEAD? I know we did talk about, other organizations being able to advocate for you and share that information. How are you doing it?
Yeah, so I think Sam and I have both been getting out to as many places as possible. That community leadership team is supposed to be doing some of that, and so we're trying to get back to them. Travis has been a little distracted. You might know. See what happens after today, but and Anna and Ricky, now that they feel like they're kind of got their feet wet, they're just pounding the pavement, meeting with anyone and everyone. So if you know of a group or, a group of parents or an organization or anybody who would like to hear a version of this or have a conversation or give their feedback, I think we're all open to that. I should extricate myself a little bit from that, but every meeting that I sit on that is with other agencies, I just keep talking it up at every point. And yet, as Sam said, Ricky says he's been introducing himself to officers and they've not heard of it, or someone else in the community says they haven't heard of it. So obviously this is serious ramp up time, and so we want to get the word out to everyone. We are working on some print material and some resources to be able to get out there. We're just running that through the team.
Did have another question I was going to ask you, and it's fallen right out of my mind. So, oh, I know what I was going to say. This is being recorded. It'll be on our YouTube channel, and I will share this video link and encourage people to watch it in the Human Services listserv and in our newsletter and on our website too. So, and social. So hopefully it'll get a little bit of reach. And Samantha and Jessye, did you have any final thoughts that you wanted to share before we close this evening?
I just want to say thank you for having us and letting us share this, and we do all welcome your feedback. I wanted to I wanted to just close by going back to that Brian Stevenson quote that I read so quickly at the beginning, but just to have that be what we leave you with. So, how can mercy translate into practical changes in our criminal justice system? The ways are countless. At every juncture, decision makers can be more compassionate. Police can presume innocence in interactions with individuals. Judges and prosecutors can recommend less punitive sentencing for defendants. Corrections officers can treat inmates with humility. One powerful way to exercise mercy: change how we treat the mentally ill and make how we treat the most vulnerable among us just. Thank you.
Thank you very much. Thank you both for being here, all of you for being here. This has been really informative, and we'll look forward to hearing more about the implementation of LEAD in our community. So thank you, everybody, for attending.
Thank you for having us.
Thank you.
Have a good night.
Thank you.